Hi, I'm Julie Hodne from Manning Regional Healthcare Center, and I'm one of the lead instructors for CPR and first aid. I've taught CPR for the last 10 years. I'm very passionate about it. CPR is so important. It saves lives, and when you register for a class, you not only learn the knowledge, but the confidence and the skills to help someone in need. CPR, if started within 3 minutes, can help prevent that brain damage. And the sooner we start those compressions to compress that oxygenated blood to the brain, can prevent that brain injury. Anyone can take CPR. Of course, I teach lots of employees that are nurses and doctors, but there's caregivers, coaches, all kinds of people. I've taught Boy Scouts, Girl Scouts, young kids CPR. They might not have the weight to be able to do the compressions, but at least they know the understanding of what we need to do to save lives. To join a class, all you have to do is register, give me a call. I usually do 6 p.m. classes for the community, and we start out with a short video, and then we start right in with the skills. We practice on some really great mannequins that give us feedback, show us the green lights that we're doing the correct depth and speed. You know, we're compressing to the speed of staying alive, and we're compressing 100 to 120 compressions a minute. We have adult mannequins and child mannequins and infant mannequins. So we practice on all the different age brackets. I go through the different techniques and practice with all the different mannequins. Along with the CPR training, we teach the use of the AED, automatic external defibrillator. This is really important when that heart is in ventricular fibrillation, it's out of sync, irregular, and it needs that shock of electricity to get that heart pumping again into a regular rhythm. So anytime you're doing CPR, I really like to see the AED used too. So when someone calls for help, try to bring the AED along with you. AEDs can be found in many public areas, like at the games, you know, there's usually one, there's some in school, in the libraries, in the airports. Grab it off the wall, turn it on, and follow the prompts. It will tell you what to do. First aid is also needed for some certifications when you're caring for children in the home. So we give a course on first aid too. It's usually tied with CPR, but you can do it individually also if you need to. We talk about the EpiPen, bandaging wounds, and finding the problem when someone's unresponsive, trying to assess that person to see what is the problem. So if a business or organization would call me, I have gone out to several organizations to teach large classes. We'll do the testing in their meeting room, or we can rent a meeting room and gather together, but I do go out to the school. I've gone to nursing homes in the area and take our mannequins with us. And otherwise we can come here to the Manning Hospital too and have large groups here too. So when you call to register for a class, please know that this is going to make it more comfortable, and so that when an emergency truly does happen, you know what to do. That will help your confidence and hopefully save their life. You may never have to use these skills, but in the case of an emergency, it could be your loved one, and you'll know what to do. So please give me a call. I'm very passionate about it, and we can get you trained in about 2 hours of training, and I look forward to seeing you soon.
Manning Regional Healthcare Center, your trusted experts close to home.